And we're back with Dr. Richard Gibney. And we're going to, Dr. Gibney, can you tell us a little bit about a concept that you talked about in the last segment, which is empowered chronic kidney disease patients? How did you all put together an empowered program for the other stages of CKD, stages 1 through 3?
The answer is it was a wonderful opportunity because, as you say, you can have CKD 1, 2, 3, 4, 5, and it's based on how much you're filtering, meaning what percent of normal kidney function do you have, anywhere from 100% down to 15 or 10% when you have to worry about having to have some kind of supportive help. Mm-hmm. And so in doing this, we looked at this, and the people at IHI and then the people in Jönköping, Sweden said, there's this massive force called the patient. And we've never taken advantage of the fact that the most powerful thing in the world is the patient. And if you'll give them permission to be involved in their care, you'll just be amazed at the things they can accomplish. And that's what's happened. So it covers the whole gamut. So if you got, I'll kind of go, let's start out with CKD. That's why it's so important to find out who are you as a person? What is important to you? And then we can modify the therapy. And our goal is to cure or heal first. If we can't heal, stabilize. If we can't stabilize, slow down the loss of function. And then finally, if that fails, then put you on some kind of renal replacement therapy, such as dialysis or transplant. But or you can say, no, thank you. You can be conservative therapy and say, gee, because of all the problems I have and my age, etc., I'll just stay where I am and continue to take good care of me. But I don't want to do dialysis, and that certainly is fine too. The important point here is the patient is the one making the decision. The patient is the one that, with their family, knows about all these things, and you have to take a very proactive role to make sure that you're doing this, because if you don't, then they, and again, I go back to that grief response. The patient and family can miss the whole story, but it's just because we didn't present it correctly. So we have a wide variety of ways to present it until we can finally find one when the patient says, I get it now, I got it. So empowerment means that instead of stealing control from you, I'm going to give you control. I'm going to preserve your control. I'm going to preserve your joy. I'm going to preserve your quality of life. I'm going to preserve your wellness as far as possible. Big difference. So let's say, and that's very important, you can imagine coming to see the doctor where it's a joyful place as opposed to depressing and awful, much better chance the patient will actually come. That's just kind of common sense.
Exactly. So I've been to dialysis units, and even in a children's dialysis unit, because in the children's dialysis unit, the nurses and doctors really work to make it a joyful. Everything about the atmosphere is to invoke joy, and even there, it is a hard place for a person to be, because the dialysis process, people often you'll start to feel a little sick to your stomach towards the end of the treatment, and there's just all of the physical mind over matter issues that as a child you don't know how to even process, So I can only imagine what an environment that is not geared towards trying to create as much joy as possible would be like in a very clinical, austere setting for patients.
There's a app called CKD and Me. CKD and Me. It's free, so you can put it on your phone. It's a wonderful animated thing that basically goes through this and talks about the different stages 1 through 5, what are your options as far as how do you deal with it? What could you do? And a whole bunch of different stuff. So highly recommend CKD and Me. Brilliant thing. And then it doesn't cover everything, but it covers a huge amount and gives you your baseline so that whenever you have a question, look at CKD and Me, and it's free, and it's just a wonderful, it's sort of an animated cartoon, very joyful, very videos on it. So it's really a powerful, powerful app that can give you confidence. And then the internet in general, there's tons of good stuff on there, but the one thing to start with would be CKD and Me. And that gives you another tool for you to take control of your health and for you to be able to retain your health and your quality of life.
Oh, you're exactly right. I mean, there are so many educational tools out there for kidney patients. We simply have to have access to them and know about it. Our biggest problem that I could see coming into the kidney space, as all of the important kidney advocates say, the most the biggest problem was that people don't know about kidney disease, which is such a strange thing to me because it's been around for so long. You would think that everyone would know what kidney disease is, simply because there are, like in the city of San Antonio, there are over 50 dialysis units. So when you go to the South Side, there's dialysis units everywhere. It doesn't matter what side of town you're on. You can find a dialysis unit near you. There are even dialysis units in malls. As Las Palmas, I want to say there are 3 dialysis units in that little strip mall. Like they're all over the place. So, but at the same time, people don't know what kidney disease is. They don't realize that diabetes and hypertension lead to kidney disease. Most people don't realize that with diabetes, you could do everything right. You can take all of your medication, know your numbers, and still end up with blindness or an amputation.
And we're working diligently now to try to make a good partnership and collaboration between the kidney doctor and the primary care physician.
Yes.
If you look at the healthcare system, you can put in the electronic medical record, and you can say, if somebody has a decrease of kidney function or has albumin protein in their urine, then they need a referral or a call by the primary care doctor to the kidney doctor to say, what do you think? What should we do here? That's an easy way, because one of the problems is that kidney disease is silent. And because it's silent, you don't know about it.
So when Dr. Gibney says silent, for my listeners, that means that you do not feel bad. It's not just that it's silent, but you don't feel bad. So you will be going along with your regular life, and your kidney capacity, your kidney function is diminishing, and you will feel absolutely nothing. You won't feel any different. Nothing that's significant enough to make you stop and take pause.
So with that, you can get a simple blood test and a urinalysis. And then if it's all normal, once a year. And if it's all normal, you don't have to worry about it. You know that your health is fine. And it's a simple, easy way to do it. The programs we have for people going to churches and having their blood pressure checked, those are great programs. The other thing we do is the ability for us to communicate, and that's a big deal. So how do you get, a simple example would be medications. And so how do we get, if you're on a whole bunch of medicines, how do we make it so that we make sure you're on the right ones at the right time, right place? Anyway, the answer is, if the medical team thinks one thing and you think the other, meaning they don't match. There's a term, medication reconciliation. It's a fancy term for saying, do the medicines of the doctor thinks and the medical team and what the patient's actually doing the same? And the success rate right now is 5%. And you think, that's not very good. And so that's another really fun project. Again, if you empower people, you give the power to the patient. And there are very good educational programs where you can say to the patient simplistically, and they can do this easily, say, I'm on this medicine, I take it this manner, and this is why I take it. And then then the patient has power. They know what they're doing, and they can say, gee, I don't need this anymore. I don't need this. I want to decrease or increase. And they can go to their doctor and say, I don't think I need this anymore, or I want to change it. And you work as a team, but you've got to give that power to the people. If the person does not know why they're taking medicine, it's not going to work very well. So we have to do a much better job educating the patient, giving them, by educating, I'm talking about changing what we do. Like we've done it for 50 years, we've done it where it doesn't work. So we now have new approaches, like with the empowerment, we're saying, you know what, we're going to try this way, and it works. And that's the same thing as the patient saying, you know, I don't want to be involved in my care, just do whatever you want. Well, you know, that if you have gallbladder surgery, probably the surgeon should do the gallbladder surgery. But if it's medical, where you're taking care of diabetes, hypertension, etc., the person has to be involved because it's your body. You'll do it better than anybody with appropriate education.
And you're exactly right, Dr. Gibney. Thank you for giving us good advice and helping us to understand what's going on with patients and the fact that we need to engage. If you have diabetes, hypertension, or a history of chronic kidney disease in your family, you should come back and listen to what we are talking about. Keep listening, because we're going to talk about patient empowerment, and I'm going to tell you a little bit about why I'm doing what I'm doing, and Dr. Gibney's going to tell you a little bit about why he's doing what we're doing. And you're listening to On the Record with Tiffany.